Hi, Bob. First, I'd just like to thank Shannon, who's going to help us out tonight. She's going to be modeling on our table to show what the Manuthera can achieve. Okay, I know we only have 45 minutes, so to get started, just briefly, my background, I started off as a chiropractor in 1985. Within a couple of years, I got into acupuncture, became a licensed acupuncturist, and just recently completed my certification as a fascial manipulation specialist with Dr. Stecco over in Padua, Italy. I have found that in my work, that what was essential was to incorporate a table like the Manuthera. Before I knew of their existence, I used an old Chattanooga, which had rotation, some lateral bending, but it was so archaic and just had, it just like moved in a ratchet-like sense. What attracted me to the Manuthera, while I was at a conference in Germany, I met a doctor who had basically 8 of these tables in his office. He was an orthopedist. He treated athletes from all over the world. I stayed with him in his office for a week and just reviewed with him the table and also going other techniques that he had utilized. And I just said, I have to get these tables into my office. And after a few years of being persistent, we finally got them in here. I'm very happy and excited that we're able to help our patients out with the table. So let me just go over some of the details with what it can do for you and why you should get one for your office. Okay, Shannon, we're going to start off with you laying face down. Okay, one thing that's great about these tables is that they have, well, number one, 2 motors, which allows us to position the individual in the most comfortable position, not just for the patient, but also for the treating doctor. So, and the other nice thing about these tables too is that they have foot level switches, so you don't have to bother using your hands. But the one thing I do like about where you have to use your hands is that everything is basically manual in terms of your flexion, your extension, your lateral bending, and what I like about that is you get to control everything. I wasn't really attracted to getting just a regular traction table where you hook the individual up, walk out of the room. Here you really have to be right with your patient every step of the way. And what's nice about it is you could make little adjustments. For instance, if I was doing some flexion extension for the lumbosacral joint, as I'm moving through my flexion extension, I could just take it to the exact degree to where the individual feels comfortable and just where I'm feeling some opening up. I could then even direct by pressing the lateral lever, and I can move into one side and I can perform the treatment at the specific joint that's affected. We could also do this in the side lying position, but for time right now, if I could have some time later on, I'll get to that position as well. The other nice feature about this table is that you can also do rotation. Everything locks so nicely, so when you position the individual, everything just stays stationary as it should. So while you're doing your rotational movements, and what I would recommend is you could actually, for your own spinal health, is to bend into this as you're moving this. Here you could really palpate and feel exactly what's going on in the spine. I find that before I'm even going to start to do any of the vertebral manipulation, high velocity, short lever movements, I'll mobilize the spine first. So these tables are great for any type of musculoskeletal disorder. I also find them very effective with lateral disc herniations, where you could position the individual into the specific line of drive and then just gently do some traction or flexion. Next, we'll do some traction on here. You just simply pull out the lever. To the segment, you're going to apply traction. You could take your other leg and you just gently glide this out. And they also have straps if you want to do some gravitational traction. It's always more comfortable, Shannon. You could just slide down just a little bit. These straps are very strong. And you'll see why. Now the patient's secured to the table. Create some clearance. And from this position, I can now do my gravitational assisted traction. I could even get into the thoracic spine while I'm doing this. And this gives me great access where I don't have to have the individual keep on standing up, sitting down, motion palpate. I could do everything all off the table, and then obviously treat from here as well. And I'll just show you some of the circumduction that can be done as well. There's another lever here for the thoracic piece that allows me to get moving the sagittal plane. So with the rotational component in here, I could also get some circumduction, so I could even achieve greater range of motion. And you know, while we're treating the lower back, it's so important not just to treat the affected segment, but the surrounding structures as well. So here with a tool like this, you're able to do this. The other thing that works great in mechanical disorders is that if you're going to be doing any type of adjusting, I find that this preps the body in such a way that most of the segments where you might have initially found that were restricted, they start to open up. So in general, I find that the patients hold their adjustments much better. You're able to position the individual into a much more relaxed state, so you could really get in there with your line of drive without any interference and make your necessary treatment. Now, while I go through a treatment, I try not to keep, I might be doing this maybe for the traction, maybe for about 5-10 minutes, and just so the patient stays comfortable, just to release the straps, and then we just proceed. The whole treatment, using what I find with my work, is roughly an hour, but you could probably do it like within 45 minutes, depending on what the case was. Okay. Okay. So moving on. Let's go into the side posture. Let's have you lay on your right-hand side.
Yep.
Yeah. Yes, just rest your head. Great thing about the headpiece, the cervical headpiece, is most tables you'll find that they basically pivot just at the proximal joint. In this particular unit, by just depressing these two levers, I'm able to lift up the headpiece, keeping it horizontal to the floor, and this is a much more desirable type of positioning, so the individual could relax in a much better state. With doing side posture, utilizing the lateral movement of the table, you could position the joint to be adjusted at the exact specific angle. And while you're in this position, while you're palpating, you can utilize the foot pedals, or the foot bars, just to get the exact angle. So for instance, the back lever will control the tilt. So if I need to get a higher tilt, just to get this joint to open up in a more favorable position. What's nice about it, you actually feel the body starting to relax, so you know exactly what you need to do. If you need to just, lower the height, and then you could do your adjustment. Also, at the same time, if you find that the individual is more comfortable if they're curved towards you or away, if I needed to do get a little bit more extension into that spine, you can do it like that. And then you can perform your treatment in a much more comfortable position for the patient. Okay, now you can lay flat on your back, Shannon. Okay. Next, we'll go on to the cervical spine. They also have this little wedge piece, just lift up, so this way the head will sit in a more comfortable position. You can come back up. And when the patient is lying supine, you want to try to reduce that forward neck flexion. This way you can get right into the cervical spine, and you can do all the necessary palpation and treatment if you do muscular work as well. And here, I always like to keep my thigh in contact with the headpiece, and I like to use my legs a lot. This saves my back. And I could just come in, I could just go through the mobilization, and you can get a really good assessment of the various different fixations. Okay. Okay, the next thing with traction of the cervical spine. Also, I just wanted to point out too, the table can be adjusted per the height of the individual. Just by releasing this lever, we could then bring out the cervical segment. I could also do the same with the back while we're doing traction in the lumbar spine. So this way the individual will feel comfortable on the table. So with cervical traction, I'm going to just release this lever. We're going to get the headpiece just so. Just center in here. And when I perform the cervical traction, I'm going to make my contact on the fixated segment, and I press my forearms into the headpiece, and there I could just glide my body back while I'm taking the offended segment here at C2, C3, and just applying the right amount of traction. If I wanted to get some more traction on the cervical spine, let's say someone wasn't experiencing enough traction, I would just tilt this slightly. If I needed to strap him in, I'd strap him in just to secure him, but in this case it won't be necessary. And the other great thing too, the height with this table allows you to keep your back in a much better position. So again, this table is for our patients, but it also is a wonderful tool that we get to utilize and not strain our backs. Okay, cervical traction. In this position also, a great way to get to the psoas fascia contacting the psoas fascia, I then can do my myofascial work. Many times when the low back is not opening up, I will check the antagonist points along the rectus and psoas fascia, and I'll either work on them manually first to free up any densifications, and then go through some range of motion. So that's really a great tool. Next, we'll do the shoulder, since I have you in this position. Okay, the arm pieces on the Manuthera are great because they move in 180 degrees and they can be lifted up or down. So for treating shoulders, I find these very effective, especially with adhesive capsulitis. While I'm holding onto the arm, I disengage the lever here, and I'll work within the pain-free range of motion, and I could cover all the anterior muscles, the pectoralis, the deltoids. When I need to do any type, excuse me, just one second. If we're going to do some work on stretching the back muscles, these arm pieces can also be adjusted to the length of the individual's arms, so you can come in here. What I like about this is that you don't need to get any other type of device to work on. Everything is just coming right from the table. And here I can control everything I'm doing. I always secure the arm piece because this is movable. It doesn't lock. It only locks at the two extremes. Then I could do my muscle work, opening up with internal, external rotation. I could do also work on the subscapularis. Sorry, Shannon, we grabbed you a little too much there. And I could also apply traction into the humerus while I do this. And it's just a much more control can be established, as opposed to not having anything, holding the arm, grabbing it, which I've done many times over the years with other tables. This just makes it much more comfortable for myself as well as the patient. And you could also work the anterior ligaments of the shoulder when the patient is in the prone position. You just position here. In fact, let's show this instead of talking about this. I'm going to have you turn over and how's the time?
18 and a half minutes.
Left.
No.
Oh, okay, good. We're good. Okay, good. Okay.
Do you want me to just go this way?
No, I'm going to get rid of this.
Sorry, you're into 22 minutes.
Okay.
7:22.
So here I have the ability in the prone position to elevate or lower the arm. Usually when someone's coming in with adhesive capsulitis, their arm is in a contracted state. So having that ability to move it into different positions allows me to work in a more comfortable position. Then from here, I can, having this space allotted to me, I could work the front part of the capsule, and we could just make adjustments as we need to, elevating or lowering this. Okay. Okay. The other piece on here which we didn't go over is the drop. What I like about the drop is that it is direction in a caudal And let me just get this disengaged. Okay. And it also allows you to do long axis extension. You position the individual slightly in an extended position. You're just going to slide down over the spindle of the table of the offended joint. You cock the table into position. Let me just come from this side. And then just with you don't want to lift up on your thrust while you're doing the drop. It's just a quick follow through. And again, you can position, depending on the patient's weight and body type, just by elevating or lowering the table, just to get the proper amount of traction. It's a very nice, gentle type of drop. It's only present in the lumbar spine. The other thing I like on the table is the fact you have the ability to position this leg piece in any position you need to. When I do any type of extremity adjusting with my toggle board, what's nice about this, because of the angle of the ankle, I could center this here, and then I can position this into the proper position where I could get in here and do all my work on the proximal metatarsal joint of the fifth of the metatarsals, the navicular, calcaneus. And you could just turn over, Shannon. As well as proper positioning in the prone position. If I want to work on the talocalcaneus joint, I could get in there and do my work. The leg is kept in the proper position. Okay. All right. I think I covered all the functions on this. I got through a lot quicker than we did the first round. So yeah, so if we have any questions now.
Okay. And I'll switch to headphones. But my only thing to you is, if you don't mind, repeat the questions, because they won't, on this camera, they won't hear the questions.
Okay.
So you just, and let me just set this up. You should be hearing it.
Okay.
So for the attendees, if you have a question, just click on the mic icon on your GoToMeeting control panel and ask away. So while we're waiting for people probably to figure it out. I'm sorry, Dr. Tosh, go ahead.
The question. Yeah, I have a question on when you're in a prone position. Can you take the arm support from? Can you abduct the arm when you're in a prone position with it supported with the mechanism, or is it just a two-position thing where it's down at the side and up above the head?
Okay, the arm positioning locks. Let me come this way. You could still see me, correct?
The question was?
The question was the arm piece. Can you position it at other intervals, I believe? Here it locks only in the forward and in the posterior. In the other position, you could, obviously, you can raise this or lower this. It swings. So what I was pointing out as I was working on for the adhesive capsulitis, I basically placed the arm rest against my thigh, so while I'm working, I could control this. So the thing that's a little bit different with this table is that it's important to use all your assets. So I find, that it's not such a, it's kind of easy after a while. You get used to it, using your legs to position yourself so you're getting a nice, secure, movable type of treatment. So here it's just going to swing. But you can, if the individual is in the prone position, you can obviously use this as well. Let's have you just turn over and just show that. So we could achieve the same type of movement if I wanted to work. I see people who are doing ART work or muscle energy to, okay. So that is very helpful. Did that answer your question, Doctor? Okay, great.
So any other questions?
I have lots of questions, so I'm just going to keep asking them until you tell me to shut up.
Hey,
Okay.
more power to you. Go for it.
So with the traction portions of this, there's a static just traction. And is that an automatic function where you're hitting a pedal that's pulling the person out, or are you always controlling that manually with your own force?
No, I'm always controlling that manually. If you wanted to use a gravity assisted, then you could have the individual stay in that position. Like if you needed to attend to another patient, their patient will be secured on here. Personally, I don't like to do that with my patients. I like to be there while I'm working with them. But that's something that you could definitely do. Remember when I had Shannon in the inverted position while she was secured to the table? I would not keep any of the other parts movable because in that state, it's very easy just to shift left or right. So I would keep everything on one track and just using gravity. I mean, I have an invert track that I use with some of my athletes. And we have them doing a lot of exercises on that while we're, that's which is part of the treatment. But in this, it's much safer. You have much better control. And the glide on here, that's something that I really wanted to drive home, especially coming from the old Chattanoogas that were so ratchety. The glide on here, once you got to get to feel the table, so you get to understand what I'm talking about, because it feels like there's nothing between you and that articulation. So when I just shift this lever, it just glides just so smoothly. You could just get on here and you could assess all the different movement patterns that are taking place. Just to review again, the rotational component, I don't know if I was on the other side, but just to show you again that what I do is I press my thigh up into the table, so now I have complete control. Also, by keeping my own back straight, I'm using my leg muscles, and I could get in here and I could assess the rotary component of the lumbar spine. And you go right into treatment after. If you're doing any type of myofascial work, you do your myofascial work and follow through with the movement. I really find that has just been such an important asset in my arsenal for treating patients. And with this also, there's 2 locking mechanisms. You only need to lock one and this will stay secure. But I try to keep everything, when I do this, where I'm doing things simultaneously, so every lever stays in the same position. And just with a quick switch, this goes back into its lock position. The traction on the lumbar spine is controlled just through this a little lever. It's on the left side of the table. You could have the individual strapped into the table. You could then put them into gravity. Here, I'll use my thigh just to initiate the movement. And here I could work on the sacroiliac, the iliolumbar ligament. Let's say if it was just on one side, I could then, let's say I wanted to work on Shannon's left iliolumbar ligament. I would lock it in this position, and I would come from a superior. Here I'm going to there's not one position that the doctor has to get into. You're going to obviously, for your body type, excuse my back, for your body type, you're going to find the best posture and position for yourself while you're achieving the therapeutic technique for your patient. So in this particular case, if I just need to become more superior, I can then traction out the table. I don't know, could you see that, Marty? Okay. Okay, so that's the tractioning component. If I answer that in full detail for you, or do you need another?
I don't leave people on traction. I just do other stuff while they're automatic traction. How about, is there a handle, or is it always your contacts on the patient or the edge of the table for your control of that lower half of the body?
Oh, I do have a lever. Is that what you're referring to? If I needed to get better leverage, and this works best when the leg piece. Oh, the other thing that I wanted to point out, I'm sure you observed this anyway. When we're doing traction, I love having the hamstrings out of the equation. So by keeping the knees flexed, this allows all the traction to take place in the lumbar and sacral region. So in this situation, I could have the individual strapped in, and then we can do the traction. Now, I'm always, again, in contact. So all I did was just disengage along the spindle of the table. So this allows me to have that long axis extension. Maybe if I come from the other side, you'll be able to see that better. Is this a little better, Marty? So from here, I could and let's say while I'm working on my patient, I also feel I want to get like a little bit more traction into the region. I'll just change the angle more into flexion. At any angle, right. Just to show you, I remember when I was doing this before, maybe my back was towards you, doctor, but you could just position this to any angle you want. And again, you can also add in the rotational component. Now, when I do add the rotational component, and I find it's much better to have the individual secured to the table. This way, with some people, if their body weight, it might allow them to just shift, and we don't want that to happen. Like I said, the straps are extremely sturdy and they're comfortable. I always like to make it more comfortable. We just put like a towel or a pillow in between them, so it's not digging into anybody's skin. And that's just another really nice feature. So as you could see, I don't know if you watched any of the other videos that are out there with the Manuthera. It just has a really, I find it has a really wonderful continuity, excuse me, I'm just trapped here, in the whole treatment process. So I typically find that I'll first evaluate the whole range of motion, passive, active. Then when I'm getting into checking for any joint fixations, we're going to go through a whole motion palpation. Now I find I could just have the individual lay prone, and I'm able to do my whole assessment and do my treatment with, in my case, I'm doing acupuncture and fascial manipulation. And the tables are comfortable enough, even though they're designed to do manipulation, but I've been finding even if I'm doing like a 45-minute acupuncture treatment, that they're comfortable enough to lay on for that period of time. And of course, you could always adjust the table to your patient's liking. And you'll find as you're working with someone, let's say you get a patient, they come in and they're extremely restricted with low back movement. You might start working on them with the table more horizontal. As you're starting to do your work in the affected area, as you know, the back starts to open up. That thoracolumbar fascia will open up. So here I could just accommodate that in this fashion, or if I'm finding that we're dealing more with thoracolumbar issues, I will then, there's a lever under the second panel of the thoracic piece that allows me to move in the sagittal plane. So I can flex that forward just to get a little bit more range of motion. And then I can go back to working the lumbar piece. Just disengage the flexion unit here and the lateral movement. And then I can assess the movement of the ribs coming on the spinous process with a flat hand connecting with my pisiform. You get a really good feel for what's happening at the motor unit, and then make your necessary adjustments. Just one thing too to point out, when you engage the table again to lock it, there's a certain amount of swing. So just make sure that you stay with that to make sure that the table stays locked. Let me come this way, getting caught. Sorry. Any other questions? Yes, sir.
Sorry, I accidentally muted myself. Will the table lock in any of the lateral flexion and rotation positions simultaneously?
Repeat the question.
Could you repeat the question?
No, you repeat it.
Oh.
So, because remember, nobody hears the question.
Oh, I see. Okay, does the table lock simultaneously in the thoracic and the lumbar? That's the question?
In side bending and rotation at the same time, or is it just? Go ahead.
I have to engage that. So, are you saying if you're treating someone in side posture?
No, if they're laying like she's laying right now, and you want to side bend her and rotate her, can you lock the table in that position?
Oh yes, yes. Okay, so the question is, in the prone position in this case, can I lock the table into the appropriate lateral flexion? This is locked. Yes, you have. I think there's 5 different locking positions in the lumbar spine, and then if I wanted to position it in flexion and extension, I can keep it in this. I could lock it in this position here, where you can just glide this down, and anywhere you need to lock it, you can lock it. So here you have a lot of range with what you can do with it.
Can you add rotation into that and lock that?
Absolutely. So with this lock in this position here, let's say we were dealing with a lateral disc protrusion on the left. I'll come from this side here, as I would want to, in this case, bring the left sacroiliac more posterior just to create some space. And then here, let's say if it was an active disc, I would just do some very gentle movement. And of course, each patient is different when they're presenting with a disc. So we have some cases where they're so hot that you can't do any mobility with them, so then you're going to be doing all your palliative work. And as soon as they start to get out of that inflammatory stage, then you could introduce the mobilization to them. So here I could get my rotation. I'm just going to go a little bit more so you can see the rotation in here. Absolutely, absolutely. Locked. Oh, yes, yeah, I rotated it. Maybe you just don't see it on here. Yes. Yeah, like I said before, I just held it because I didn't want Shannon's torso to twist too much. But here I would have her secured to the table with the straps. It just works much better. Okay. Okay. So that answered your question, sir? Okay. Good. Okay, any other questions? Oh, okay. So, repeating the question, how much travel extension do you get in the lumbar spine? You can adjust that by where you place the height of the table. So if I'm going to lower this a bit, I'm going to minimize my travel extension. But let's say I just needed to change that around a little bit. I can put a little bit more of an angle in here, and this is going to give me a much greater degree of extension. I don't recall the exact figures, but they are listed in the brochure, and they will tell you the various different travel extension length that you could achieve with this. Okay, so let me just lock.
I guess, can you just repeat and show some extension treatment into the lower back?
Sure. I'm going to repeat the extension treatment in the lower back. Excuse me, flexion, extension, obviously. Another nice thing with this, this reminded me of another thing I forgot to tell you. We can also use this diagnostically just by disengaging. Sometimes someone will come in and the spasm is so tight. Just by them laying prone on the table, the contraction, let's say on our left side, you'll actually see the whole table just shift. Then you can go back and retest it as well after you do your work. Was that a clear demonstration, or do you need to see like another angle?
Much.
Okay.
Yes, thank you. Have
My
a good day.
pleasure.
Bye.
Bye-bye, thank you.
I have one more question.
Yes.
What's been your experience working with very heavy people on this table?
Like how heavy?
350.
Oh, okay,
Plus.
350, I wouldn't put them on the table. You have, I think, a maximum of 300 pounds. That's it. So I have to, unfortunately, it's a good encouragement for them to get on a weight loss program. The question was, how well does a table work with a 300-pound individual? And you're just at that range. I think it goes to 350, but I kind of treat these tables with kid gloves, so I'm not gonna push it. But they are tested up to 350 pounds. Okay. Let me get you up, Shan, a little bit.
Actually, it's 330 pounds. Is the
330? Okay.
The weight. Yep.
So you could do the 300-pound patient. Personally, I don't have anybody 300. Actually, well, that's not true. I did have a patient. She was 300, but we got her. We're so proud of her. She lost 150 pounds. God bless her. She's doing fantastic. Now she can go on the table. Any other questions?
No, I don't think so, Chris. Maybe from my perspective, maybe you can show the drop section. I think that we forget about the fact that the table has that feature.
Oh, I'll review it again. Okay. So the drop section is just in the lumbar spine. By just disengaging the first knob closest to the spindle, that helps you to disengage and engage the drop piece. I find that by placing the individual into extension, the other thing that I really love about this drop piece, it's lining right up with the facets, where a typical drop, similar to the toggle, the line of drive, once the instrument is cocked, it's just basically from P to A, and that's it. It works great when I'm doing my extremity work in the ankles and the wrists, but for the lumbar spine, you also want to get a nice stretch on that iliolumbar ligament. So let's just demonstrate a drop again. So what I find while I'm doing the drops, because it's like a hairspring mechanism, I need to adjust the individual into extension just to get the right amount of traction, or I'll just have them slide up a little bit. But if I need to get onto the like L5, S1 area, I need to have them aligned right over where the drop is. So depending on how I have the table positioned, I could come up from the superior, and it's a very, very light drive. And again, you don't want to cock your arms off. You want to keep the traction onto the joint, and then it's a light thrust when it's cocked. And it's just a very light thrust, and that's it. And then again, with the drop, you also have the ability to direct it right to the offending joint. So, and in fact, in this position, it's actually helping that L5-S1 joint to open up a little bit more. So I will have that cocked and ready to load. I could also add the traction into this as well. So you have that choice whether you want to add traction into your drop or if you just want to get that slight little movement. And I guess it all depends on the condition that you're treating. So here, I'll make my contact, and it's just a slight little movement, and that's it. And I could adjust the tension with the drop, again, just by positioning the lower body more into extension. So I'm going to get just a little bit more of a resistance if I need to get a little bit more of a thrust. But you can go back and motion palpate right after you do that, and you can actually feel the change that's taken place. Okay? Were you able to see that, Bob? Okay. Do we need to review any other tables, the differences? You want to go over that?
I think most folks are aware of what else is on the market. You've done a good job of demonstrating the uniqueness of this table, for the attendees. Once again, great job. And unless there are any other questions, I think we can. Oh, I see somebody else just open up their mic. Gilbert, do you want to ask a question?
Probably the one everyone else wants to ask. What does this table go for?
Bob, Bob, you can answer that question.
Yeah, so we generally sell the table for right around $14,000.
I figured it was going to be in the 12 to 15 range, so yeah.
Yeah, and so, you put it into context with a Cox table, that has a little more automation, but I think as Dr. Kaltukas has shown that the sensitivity and the ability to hands-on with your patients, this is a good price range for as versatile as this table is.
Yeah, let me just add on to what you were saying, Bob. With that price, is very, very, in my opinion, very, very fair and very tractable. The other thing that you have to keep in mind, with a Cox table, you're going to have a lot more automation, like Bob says. But with that, I have found that with some of the other tables that I had, the more automated tables, that they were much more costly to run. Now, since 2010, I had the first model of the Manuthera, and I spent literally $0 on maintenance. Zero. I was able to do everything myself. I think I had to replace a piston on the cervical headpiece, where the pistons on the cervical headpiece allow to get the this flexion and extension movement on here. And it was just a matter of simply just taking a pin out of the shaft, screwdriver, and putting it back in. I put a call in. This I called Lojer directly. They sent the part over, and it was no issue. And I can't tell you, I'm sure you gentlemen also have found the costliness of what the uptake is on taking care of a table. And this, literally, since 2010, I have spent $0. And the other thing, great thing, is that these tables have kept working. There have been no issues. You don't have to put the table to the side because it's not working. I've go to visit some of my colleagues, and there's always a table that's laying there in repair and then waiting for the repairman, and it's so difficult to get a good repairman to come out. I had a guy when I used to have those tables, but he actually he folded up the business because he just couldn't keep up with running all over the place. So I'm not that handy, but these tables are so simple to upkeep on. And that's another thing to consider when purchasing. In addition to what I find to be just an irreplaceable tool. It allows you to do so much more. I do like the Cox tables, but I have to say the automation part of it is not something that I was looking for. I just feel I have so much more control when I'm working with a case by having everything manual. Other than the fact that having these two motors where you can position and angulate, let's say if Shannon was complaining of some sinus difficulty, we can just simply, while we're in the prone position, just tilt this up ever so slightly just to take the angle off there so the sinuses will drain much better. As you know, when you're treating someone, if they're more comfortable, you're going to have a much better outcome.
So I'm a massage therapist. I'm not a DC, but I do a lot of more, I guess, orthopedic medical type work.
Okay.
I've been looking at a comfort craft as an option for a table. I like this because it's, gosh, I mean, you just have so much mobility. I do ART work. I do a lot of myofascial work. So this has just a lot of the movements that would be helpful for that. But I guess, would this be overkill for that type of work? I guess the difference in price between a comfort craft that I'm looking at, I mean, that's almost a $9,000 table. So there's about a $5,000 difference here. But you do myofascial work.
Yes.
How has this helped you in being more effective doing myofascial release? Okay,
great question. I'm just going to repeat it for the audience. This is a massage therapist asking, is this going to be overkill for him to have a table like the Manuthera versus what was, I'm sorry, the other name of the table was a comfort craft. I'm not familiar with a comfort craft, so I can't go into the differences. But to answer your question, I personally, for doing myofascial work, Well, as you know, as you're palpating, sometimes just like the slight little nuance in the change or angle, you can really bring out the affected lesion. For instance, if I'm working in Shannon's lumbar spine and the tissue is just so constricted, because even in this slightly flexed position, if I just go into some slight extension, I could relieve some of that tension. And then by just throwing in some lateral movement in here, I could actually get right onto the fibers. And this I really found very effective. I do fascial manipulation, so I'm looking for a densified point, a sclerotic point, a fibrotic point. And I have to say that after going off like a flat bed to coming onto something where I could adjust that into the proper position, and let's say I found it in this particular case, I'm really bringing out that fascial density, I will just lock the table into position and I could just do my work in a comfortable position. And having the ability to tilt the table up or down, not even thinking about if you're going to do gravitational work. You don't even have to do that. That's just like an added luxury to have while the patient's going through their rehab. Just having all this minute little angulation to change and shift, it is so, I can't tell you how, whoops, I'm sorry. I shocked you there, Shannon, sorry about that. I could get right into the proper posture and do my work. And the other great thing about it is that you could go back and you motion palpate. You know, you do your work, and I think it's actually better, which I find in my practice, that after I do some fascial manipulation, might do a round of 5 points, I'll go back and do some range of motion, and the person will actually, we could actually tell if we're on target. The range of motion should start to improve, the tenderness should start to come down. Overall, we should see some type of a progress. And if I'm not seeing anything, I might go back onto another plane of movement. Maybe I just got the wrong one. So this I could correct my path and line of treatment all in one. Does that answer the question? Okay. Oh, the height? Oh, okay. I don't have the brochure in front of me with the exact figure. Let me just straighten the table out for Shannon. Yeah, so when I'm doing my side posture work, I find it essential to get my weight. It just come off to the side 1 second, Shannon. Okay, you can rest your head up here. Yeah, so while I'm doing my side posture work, the other thing too that you also want to consider when you are doing your side posture work, whether you're doing fascial work or high velocity short lever manipulation, you can adjust the rotary component in here. You could also adjust the lumbar section. So this way you can flex the spine closer towards you. You could also angulate the top of the bed if you need to get a little elevation. Let's say I needed to get to the left L3, L4 facet. Then I can take the thoracic piece and I can lower that. This allows me to just get a little bit more movement into that spine. And then I could get my body in a much more comfortable fashion to deliver the adjustment. The other thing I wanted to point out is that on my tables, I never took off the casters. if I did that, I could actually get this table even lower. I find that at this height it works for me, and just at this junction in time, I just need to keep the casters on for easy moving. But with that said, this piece over here, there are casters that come with this. You just attach them on, and then with a quick lever, you can just roll the table into any position. I'm doing it this way right now just because it's a little bit easier, because I have to move the table around when we do these video presentations, and I'm changing my office around, so I just like to keep the casters on. But you can get stationary ones and just adjust them and lock them in. So if you need to get lower, you'll be able to get lower with this table as well. Probably this is adding on like another, I would say another 2 inches. You could probably drop this. And for me, I'm 5'10". This works perfect. Yeah. Yeah. Okay. Okay, Shannon, this is a question for you. They want to know how comfortable you felt on the table after laying on this for an hour.
Well, I'm used to it because I come here, but I'm comfortable. It's not. There's certain times you'll have to just slightly adjust to find your right spot, but I feel fine.
Yeah, okay. And now, obviously, we're dealing with human beings, so I try to accommodate everybody according to what their preference is. So I find, actually, Shannon, if you see those pads,
The white?
not the black pads underneath the. There's a other. I'm sorry. Yeah, see those 2 black pads? Not that one. They're underneath the pillow, Shannon.
Yeah.
I just wanted to show you this. You can use a device like this. It just simply lays over the entire table, and because it's all sectioned, it's going to go with the movement. But what I really don't like if I'm going to be doing maybe more just like myofascial work or acupuncture, and someone is just uncomfortable, just by simply putting something like this on here, I'm still, in fact, if you just lay on top of here, Shannon, we could just demonstrate that. So with this section directly over the spindle of the table, I can still do my flexion and extension work, and there's no interference. I could also do my lateral bending work with minimal interference. I would probably have to separate this a little bit more. But then again, I try to instruct my patients while we're doing the treatment that it would be most beneficial to have their body directly in contact with the table, because we're just going to get maximum advantage with it. And when I got these new tables in, I purposely just set up one in one room, and I kept my old table in the other room. Everybody came in and said, I don't want to go in the other room, I want to just go on the new table. So I had to just see if people could actually pick up a difference without me even saying anything. And it's something that once they experience the movement on here, you really don't want to go back to those stationary tables. So in my opinion, this has benefited my practice and me being able to treat more conditions comfortably, more effectively, and it just offers a whole new dynamic. So with that said, this is, in my opinion, truly worth that price differential from some of the other tables. And in fact, it's even less expensive than the Cox table. I believe that the Cox table is probably at, I think, another $5,000. But with all that gadgetry on there, that kind of makes sense. But in my opinion, therapeutically, that the Manuthera has it beat, because there's so much more in terms of mobility at what you could achieve with the therapy bed. Did that answer your question?
I think
Yes,
that
it
is.
did.
Well, wait a minute, Gilbert. Anything else?
No, that's it.
Thanks for your questions.
Thank you, Gilbert.
All right. Well, once again, thanks, Dr. Kaltukis, for your time and your expertise on the table. That was awesome. We're all a lot more. We got a lot more insight into how the table works as a result of this. So, thanks again, and everybody have a good evening.
Great, thank you, Bob. And I would just end by saying, really, anyone who's interested really should try to experience the table. In my case, I actually hopped on a flight and flew over to Helsinki and went right up to Lojer, because if I was going to invest in a table, I wanted to make sure it was working. It had a dual purpose because I was off to another conference anyway in Europe. But I was so glad I made that trip, and they're so friendly and helpful. And it was the first time I got a treatment on there, I just said I just have to have this in my clinic. So thank you, Bob, for the opportunity to demonstrate the Manuthera 242. Okay, thanks, Shannon, for helping out. Thanks, Marty. Okay, good night, Bob. I'll talk to you soon. Do you need to talk to Marty? Okay, great. Have a good evening.